So the talk I gave today was really a case-based review, really focusing on the importance of high-quality breast imaging, really emphasizing the importance of high quality to allow accurate and early diagnosis of breast cancer. And so I gave a series of examples illustrating that to a large number of radiologists from Egypt. The feedback was really amazing. It was really well attended, and I think it's something that is very important, and I heard that loud and clear. One of the findings that I've seen in my experience is that sometimes the quality of the mammograms are done in a way that doesn't include all of the breast tissue, and it's not recognized as poor quality, and that means that we don't include the cancers. And I really was trying to emphasize the importance of high quality positioning to be able to permit that diagnosis. So I think that we need to improve that education across not only Egypt but many other countries, and so that was what I was really trying to convey. Well, I think what you're doing here is actually a great idea, you know, to be able to disseminate it on the web. It's expensive for many radiologists to come here, but if we use some of the tools that are available to us on the web, this really helps disseminate that information in a much broader way. I understand that actually it probably is an issue, that the amount of equipment, the number of mammography units, for example, in Egypt is not what they'd like it to be. And so it's something to improve the awareness of the need for these machines and high quality imaging. And I think that's how you start, is you demonstrate the benefit. So currently, MRI right now is an extremely expensive tool. It typically takes 30 minutes for many centers to do one patient at a time. And in women who are at the highest risk for breast cancer, it may be the only diagnostic tool. It's the most sensitive tool for breast cancer. And so because it's so expensive, there's very limited access. And we see in many countries, including Canada, that we don't have enough access to breast MRI to make the diagnosis that really could help save a woman's life. And so Christiane Kuhl published her results on doing an abbreviated MRI in 2014, which showed that you could reduce the time from 30 minutes to 3 minutes. And you could actually be as accurate as a long MRI. And so what we've done at the University of Ottawa is actually implement this in a randomized controlled trial for women who are breast cancer survivors. And we've been able to show that the cancer detection rate using MRI was as high as 5%. So we, compared to the mammography where there was absolutely no cancer detection in these women. And so what I wanted to share with the conference here is that it is feasible to do, and that by doing a much shorter protocol, you can actually increase the access and decrease the cost of the MRI to allow more patients to be done. And I think that that is the way we have to do to improve some screening for women who are at higher risk for breast cancer to help reduce the poor outcomes in some of those women. I think that it's a real opportunity for us to collaborate. I definitely learn by coming to this meeting. I learn about how imaging is done of the breast in other countries, and I think it really is an opportunity to share best practices, and not only that, to collaborate with friends from India, colleagues from Egypt, from the United States, as well as meeting others from all over the world.